Good morning, friends. This is Dr. Shobhit Gupta. Today, I will be explaining you the gynecomastia surgery. The gynecomastia surgery, how it is done, and what are the exact steps, and how do we do marking and all for the patient. This patient came to us with grade 2 gynecomastia. As you can see in this, first we do marking in this patient. We mark about the fat and the inner gland which has to be removed. And in this procedure, I would be in this video, I would be explaining you the exact procedure, how it is done, and how the fat suction is done, and how the gland is removed, and how the final appearance of the patient comes out to be. This is how do we do marking, and we would be clicking your photographs without your face, and we will not publish any of your photograph without your consent. This is absolutely private surgery. So this patient was operated with us, and this was under general anesthesia. That means the patient is completely sleeping and he's completely comfortable. So when first of all we are doing with the infiltration, we have already done that step. We have started our video from the step of with the fat suctioning, and we are doing the with the fat suctioning. As you can see, is that we are doing fat suctioning on left hand side first, and as you can see in this tube, we are getting the fat outside the body. Slowly and steadily you can see that the fat is coming out through the tube in this special machine which is called the liposuction machine, and you can see it very clearly. And now we are doing about the right side liposuction. In this also, the first we are doing a left side, and then we are doing a right side liposuction. As you can see in this tube, the golden fat it is coming, and so less blood is coming because we use special with the infiltration fluid, so that a minimum blood comes out, and it is absolutely safe surgery because hardly any blood or any other fluid comes out. It is pure fat which is coming out from the chest. And as you can see in this machine, you can easily visualize the fat which is coming out, and the patient is completely sleeping because he's under general anesthesia. He is under complete anesthesia and he is comfortable in that. We can also do under local anesthesia, in which we do infiltration first, dismiss होने हो जाता है, and after that it is completely painless procedure. But this video is only under general anesthesia. That means that the patient is completely anesthetized and he's completely sleeping. As you can see very clearly, so much fat is coming out. In this patient, approximately 500 to 600 ml of fat came out from both sides. As you can see now, that the liposuction is completed on both the sides, and we have started the gland excision. As you can see in this video, we'll also show you closely. We have given a small incision which is below your nipple, just on the border of your nipple area, and it's a very small incision, so hardly any scar is visible in the future. And as this was grade 2, so we have to remove a good quantity of gland to get him a nice shape. And also we have to use special instruments to remove this gland, and to get a nice shape for the patient. And as you can see that it is hardly any blood comes out of it, and any other complication, because we are above the muscle and we are below the skin. So we will eventually remove everything which is above the muscle and which is below the skin, and that includes fat or that includes gland. We'll remove almost everything. We'll just spare a very thin layer of fat which is below the skin, so that the contouring is good. And as you can see that now the gland has started to come out. It is on the verge of coming out, because we have to separate it from all throughout the area below the nipple, from all the quadrants of your chest, from the south pole, from north pole, from east pole, from west pole. We have to excise it from everywhere. As you can see that we have a very full-fledged operation theater, and we have all the latest machines available, and it's very nicely done with proper aseptic conditions. The patient is absolutely comfortable, and we are using the full precautions of the sterility and the infection control of the high grade level. and this is done. And as you can see is that the gland has now come out on this side, and now we have started the suturing. As you can see in this video, that we have started the suturing, and um, the stitches are very fine. It is like 50 or 60 echelon, which we call in our scientific terms. In layman knowledge, it is just like your hair. It is so thin, and hardly any scar that comes out of it. I'll also show you the final photograph of the picture, so that you can appreciate that there is no scar in that. And I will also show you the picture of the gland which is eventually coming out from it. As you can see is that I am doing it. So we are doing now the suturing on right side. I'll eventually show you all the photographs of the patient, which is post-operative, and what is the final appearance after the surgery, and how the gland looks when the surgery is completed. Now the suturing is getting complete, almost it is completed, and we are doing a very fine suturing so that eventually no scar comes out. You can see clearly in this video that the sutures used are so small and they are so fine, so that no scar should come. And we use micro special instruments, so that there is no trauma to your nipple, and you can see how the nipple is erected and how there is no depression below the nipple, and how the shape is coming out, which is absolutely normal. And no one can absolutely tell you that there is any gynecomastia surgery being done. And the look is absolutely normal, as such that there was no gynecomastia. And it is no one can even tell you that there was any surgery performed on your chest. As you can see that the sutures are getting completed, and now the sutures are complete on both the sides. And as you can see that there is no scar mark visible. This is the gland which has come out. See how huge gland. And this is the photograph when patient first comes to us, and the first visit is on the 7th day. As you can see that there is small inflammation and small redness around. And this is the final photograph of the patient when the patient comes out to us on 14th day, because the stitches are removed on 14th day. And as you can see now that there is no swelling, and there is absolutely no scar, and no visible problem in this patient. And the chest look absolutely normal, and that there is no signs of gynecomastia, no depression anywhere, and it is absolutely normal. And the patient was very happy with this result. And like this, every patient of ours are happy, and we expect that you find a good uh, thing with us, and you are also satisfied with this video. And kindly help us with the feedback, and the details of our clinic and our center has been shared below this, and it's also available on our website. You can call us, you can WhatsApp us, or you can email us, or you can leave a query on our website, so that our team can get in touch with you, and we can help you with all your queries and the thing with gynecomastia. Thank you for watching. Thank you. This was Dr. Shobhit from Plastic Surgery and Women Healthcare Center, Karol, Bagh, New Delhi. Thank you very much.